So the purpose of a parent-teen session differs depending on the person's problem area. So in the role play that we just did, clearly the purpose of bringing Dad in is to work on the communication that Tara is having with Dad. So really thinking about it as sort of a role dispute and her being able to talk to him in a different way. If the problem area doesn't involve the parent, it still may be very helpful to bring the parent in the middle phase. But the purpose there may be just to update them on the progress that you've made in treatment and to help them support the work that you're doing in the middle phase. So let's say it's a problem area of interpersonal deficits. This person has a really hard time forming and developing friendships. But as you're sort of exploring that more in the middle phase, you also realize that parent is a little bit overprotective. And so it's kind of a combination of the kid's deficits and having some concerns about reaching out to people, but also because the expectation is at the end of the day, the kid comes home, takes care of their siblings, and so there isn't really an opportunity for peer interactions. You may bring a parent in that situation to update them on the progress that you've been making with the child and that really you're working on developing relationships with peers. But in order for that to happen, it would be helpful for parent to be supportive of that and then to use the session to kind of negotiate between the parent and the teen what would feel okay, both for the teen to do and the parent to do. So that way the parent kind of becomes a coach and knows that the kid's goal may be to spend particular time with a friend or two, and the adolescent and the parent can figure out how to do that in a way that they both feel comfortable. So that might be a way of bringing parents in to sort of support other work. Another example of that may be, let's say we're using our Tara example, and our focus is on Dad, but Tara feels like it might be helpful to talk to Mom first to kind of get Mom on board, that Tara's feeling really reluctant to spend time with her dad and feels like Mom pressuring her isn't really helping. So although Mom isn't necessarily the focus of the treatment, we could still bring Mom in and have Tara have the ability to communicate something effectively to one of her parents with the goal that she would then go on and continue the communication with her dad. When we bring a parent in, regardless of the problem area, the goal isn't necessarily to resolve a problem. It'd be really nice if in 20 minutes with a parent, you could sort of fix all the problems that they have, but we'd probably all be out of work if we could do it that easily. And so what we do instead is we really want to focus on their process of communication. We want to show them that there's a new way that they can communicate with each other than what they've been doing at home and get them started on that process. And so what you'll see as we do the role play, we're not as much focused on what's the outcome, is Tara going to go and watch the soccer game with Dad, but more on getting Tara to communicate her feelings effectively, to talk about how things that Dad do make her feel, to acknowledge her role in it. And so as the therapist in those sessions, your job is really to stay as focused as possible on the process. We like to prepare, as you saw in the session, to prepare the teen before you have this session. This is highly anxiety-provoking for a lot of teenagers and their parents to be brought into session together. One of the reasons why it's anxiety-provoking for teenagers is that you've only heard their side of the story for 6 or 8 weeks now. And most of them know that there's more than one side of the story. And so when their parent comes in, they're really worried that their parent will tell you all the things that they've been doing to contribute to the problem. And so it can cause a lot of anxiety, and so it is important to really prepare them. You want to pick a topic that's low intensity if possible. If this is the first time they're practicing this new way of communicating, we want to practice with something that they can do without getting super angry or upset. Sometimes you don't have a choice. You have a high intensity topic that you need to discuss, and in that case you just lower the expectations for what you're going to be able to accomplish in the session. But all things being equal, you want to pick something that's sort of low intensity. You want to talk about what techniques might be most useful and script the conversation in much the way that we did in the role play. You would then want to role play the conversation so that they really felt that they had the skills needed to have that conversation in session. And similarly to what we did at the end of the session, I think it is important to figure out who will invite the parent for the session and exactly what that looks like. Because there are times where the way you ask it can sabotage the entire process. So an example is a case that Mom was really not particularly on board with treatment. the therapist and the adolescent had made an agreement that the therapist was going to ask the parent into session. But in the moment of an argument, the adolescent said, well, that's why you're coming in, because you're unreasonable and that's why you're coming into session. Well, not surprisingly, not only did mom not come in for session, but mom actually pulled her from treatment. And so it is important to spend some time thinking through, what type of parent is this? Is this a parent that it may be helpful if I call first? Is this something that we need to even script? How am I going to ask the parent to come in? Because we do want the parent to come in and be as non-defensive as possible. And the purpose of the session is not to attack the parent, nor is it for the child to be attacked. And it's helpful, I think, for everybody to be aware of that. When you're the therapist in a teen session with a parent, it's anxiety-provoking for you too. So the parent's nervous about being there, the teen's nervous about being there, and you as a therapist may be nervous about being there because you have the potential to get into a volatile discussion between the teen and parent. But your job is to try to keep the intensity as low as possible and to provide a real introduction to the parent about the purpose of the session. So typically we'll provide a brief update. These are the types of things we've been working on in treatment. We thought it would be helpful to invite you in here today so that your daughter can have an opportunity to practice some of the skills she's been working on. As you know, this is a treatment focused on trying to improve our communication and problem solving. And so your daughter has something specifically she'd like to work on today. My job as a therapist will be to act as a coach for you. So I don't want you two talking to me. I want you talking to each other because the purpose is to try and improve your communication, not to have you talk to me. And so my job will be to be as coach. I'm going to take a step back, and I'm really here to help the teenager work on the skills and do the things the way that we've talked about it. I also can intervene when necessary with the parent if the parent could use a little coaching and help. So most of my focus is on the adolescent and what they're communicating, but if I feel like an adolescent's trying to communicate something and I feel like maybe the parent isn't hearing it, I'll slow things down and ask the parent if they can give a response. And you do want to intervene if it does start to get too hot and remind both the teen and the parent that the techniques that we've talked about may be useful. So I might call a timeout in a hot situation and have a brief conversation with the teenager and say something like, this might be a really good time to use an I statement to let your father know how it is you're feeling, to try and get them back on track with using their communication techniques. The other thing is that it is a very rich opportunity for you to observe what happens with kids and their parents or whoever else comes into session, and that you want to use that information to guide future interventions. If you see that this is really a very difficult and challenging parent, even with you in the room, then what your goals are and your expectations for what this adolescent can do out of the room are going to be modified because you know how this parent responds. If you see that the parent, in fact, seems to be very responsive to a particular technique, I noticed that your dad really quieted down when you gave to get, then I might want to use that technique more in the interactions moving forward. It also sometimes gives you very important information about the adolescent and what the adolescent is doing to contribute to the problem. And they may not like you recognizing that so much, but it can be very useful. And it can also help build rapport with you and the parent. So an example of that is I saw a case whose problem area was really interpersonal deficits. And we were focusing really on her communication and relationships with peers. And with peers, she had a lot of social anxiety in addition to depression, and so had a lot of sort of reticence to approach peers. And that was really the focus of our sessions. So I brought mom in thinking, we would just sort of focus on that. But girl was very, very different with mom. So she was very reticent and shy with her friends, but she was downright obnoxious with her mom. And her mom was getting fed up. And we were doing a session, and mom was communicating to her, and she started rolling her eyes, crossing her arms, and twirling around in her seat. She used every nonverbal possible to show her mom that she wasn't listening to her. And we had a really good relationship, so I don't necessarily recommend that you do this, but I said, I'd like to take a time out, and I want you to be mom for a second, and I'm going to be you, and just say what mom was just saying. And so I started twirling in my seat and rolling my eyes and crossing my arms, and she started laughing. She had no idea that that's what she was doing. And the mom was so thankful because finally somebody was seeing that this girl wasn't listening to her. And it really allowed me to recognize that there was, in fact, a lot of work that we needed to do between the child and the mom. And so some of our focus as we moved on in treatment really changed. So I think these sessions can be really powerful in making changes in communication, really focusing on the process, but also in getting you to recognize how you may want to intervene differently moving forward. Just to give you a sense of the structure, we think it's important to prepare the adolescent. Even if you've spent the entire session before, it's been a week and a half since you've seen them last, and so you want to start that first 15 minutes with the teen alone. You still want to do a symptom review and a mood rating. It's a really good opportunity to find out about some crisis or something that may change what you're going to talk about in the session. And then you want to review the main points that will be discussed. There may be time in that 15 minutes to do a very brief role play, or just to sort of reiterate, these are the 3 points, this is how you're going to start, to make sure they're really ready. You may also meet with a parent alone, particularly to prepare them for the session if you think that there may be some resistance. So if you know that a parent is likely to be difficult, or a parent has been against treatment to begin with, or a parent may think that their child isn't really depressed but is just doing this to get attention, you may spend some time with the parent to also prepare them for the session. You would then bring them together for about 20 to 25 minutes to really focus on the communication. Again, providing an introduction to the parent, if you haven't individually, about what the purpose is of them coming in. And really setting the expectation low that the goal is not to necessarily resolve the problem in here, but to start the process of communication that we hope they'll continue to do later on, and to make clear what your role is. The other thing that setting the structure does is the teenager has nothing to worry about you breaking confidentiality, because the way we've set it up, they know exactly what you're going to talk about. You've scripted it together. You're not meeting with the parent to sort of tell on the kid, and that really reduces their anxiety as well. So you meet with them for about 20 to 25 minutes. You focus on their communication. As a therapist, you act as coach. And then you ask the parent to leave, and you sort of spend the last 5 or 10 minutes debriefing with the adolescent about how they think it went. Clearly, that's more important to do when it hasn't gone well. And especially if they're about to go home with that parent, you want to make sure that they're okay and leaving the session okay. It's also helpful to debrief, even if it did go well, to sort of acknowledge, wow, that went a lot better than we expected. Sometimes their reaction is, well, that's just because you were here. And you can say, okay, well, that might be the reason, but what I'd like you to try and do is continue that conversation outside of here, or do something else to sort of maintain those gains. And then your plan would be the following week to either review that session in more detail or to kind of move on. So we do break the session up in that way, also because I think to spend time for 45 minutes discussing a hot topic is probably too much for everybody to handle. And so this makes it much more manageable. Okay, so what we're going to do now is we are going to role play part of the parent session. The part that we're going to role play is assuming they've already met individually. So Laura and Tara have already met individually to practice what we've done, since you already saw a lot of that. And this is just going to be sort of the 20 minutes or so with the parent. Okay. We all need to use our imaginations a little bit, because we have a teenager who's older than a teenager, and a dad that is clearly younger than a dad, or certainly younger than this teenager's dad. But hopefully it will still illustrate the purposes for you.
Well, thank you, Mr. Smith, for coming and joining me and Tara today. I really appreciate you making the time to come in. As you know, Tara and I have been meeting for several weeks now, and she's really been working hard on her communication skills and figuring out how to improve some of her relationships that she feels would help her to feel less depressed. So what we're going to be doing today is Tara's going to be talking to you a little bit about her feelings and what she's come to understand would help her to feel better. And my job in this session is that I'm going to sort of act as your coach. And what I want the two of you to do is to really try and talk to each other in a different way than you may have the opportunity to do at home. And I may interrupt and stop you from talking to sort of get you to focus on what the other person is saying, maybe listen a little bit differently. So I hope you don't take offense if I do that.
Not
it's
at all.
just to sort of help illustrate some of the things that we've been working on. And what I really would like for you, Mr. Smith, since you haven't been involved as much in the therapy, is to be able to sort of sit back and listen a little bit and maybe not respond so quickly as you hear Tara may be expressing some things that you haven't heard before, and sort of sit back and listen before you take the time to respond to her. But the goal of this session together is to get the two of you to see that you can talk to each other in a different way and hopefully, I think, improve your relationship. Do you have any questions before we start today?
I don't think so.
No? Okay, great. And Tara, you're looking a little nervous because we practiced last week, right?
Yeah.
And so you have an idea of what you want to say. And do you think you can start? Do you want to remember how we practiced starting the conversation?
Yes.
Okay.
We started off pretty easily. Just wanted to thank you for coming in to my therapy session. I asked you to be here today because I wanted to tell you that, I've been going through some stuff, and I know I've been kind of moody and crabby lately, but I want to let you know that it's not just towards you.
What do you think about that, Dad?
Yeah, I think we can all tell that she's been a little crabby at home. Makes things kind of difficult. But I'm glad I could be here to help out with that.
Great. Good. How does that feel, Tara?
Feels okay.
Yeah?
I guess I kind of wanted to make the point, though, that I've been trying not to be crabby and moody at home. That's something that we've been working on here. So I had some ideas on how we can work on not being kind of arguing and stuff with each other. So
Okay.
I didn't know if you wanted to hear some of those ideas.
Yeah, definitely.
Okay, well, one thing I wanted to tell you about was I'd like to start spending more time together because I feel like we haven't really been. I don't know if you agree with me or not.
Yeah, I mean, even when we spend time together, we're spending time, but not necessarily together. We're kind of both doing our different things.
Yeah, and I know that's partially because I've been kind of snappy and stuff and sort of mean sometimes, and I'm going to try really hard, not to be like that anymore. But I was also hoping that you can do some things like being more sensitive to when I'm not feeling so happy. Sometimes you make these comments and it can make me feel even worse about myself.
What kind of things am I saying?
Stuff like, oh, you're so crabby, or just commenting that I'm a drama queen.
Oh, I'm just kidding, though.
So let me stop you there. So you recognize that you make those comments.
Yeah, it's more just to lighten the mood a little bit, because I know she gets really worked up, so I try and just make things a little easier and make light of the whole situation.
Tara, can you tell Dad a little bit more about how that feels for you?
Yeah, well, I guess I understand that you're trying to sort of make it less serious, but it is actually a serious problem that I'm dealing with, and it makes me feel like we're not going to be able to connect if you don't understand that.
It seems like you guys did a really good job of communicating here today, and I'm wondering what's different that you're doing that you felt that you couldn't do when you go and visit Dad, and how does this seem easier for you, and how can you make this possible when you're not here in the therapy session?
Well, I guess it helped that I practiced a lot. And it helped that we were just like focusing on that one thing. We weren't like in the middle of taking Lisa somewhere or making dinner. So it helped me think better.
So one of the things that Tara and I have been working on is timing. When is a good time for parents and kids to have conversations to be able to talk about things that are bothering them? And it sounds like with Sue and her kids and Lisa that a lot of times the two of you don't have that quiet time and that special place where it's just the two of you to be able to talk. Does that sound like it happens?
Yeah, it's stressful sometimes. I get home from work and there's dinner and then Sue and the kids are there, and I think Tara sometimes expects me to just drop everything and focus just on her. And that's not always easy, and it can't always be that way. There's other people involved too in the family. I think she needs to understand that.
Tara, you look a little upset when Dad said that. Is there something that you're feeling that might be good to express to him here?
Well, it's not, I don't expect you to drop everything. That's just like, I never ever said that.
Well, it's apparent when you roll your eyes and you stomp out of the room and you make a big fuss that you're not happy, and when you don't get things right away, or my attention's divided and I can't focus everything on you right away.
So let's stop there because I think Tara's getting upset. And what I want to point out is that that's part of what we've been working on, and Tara's really been working on, rather than rolling her eyes and huffing about, sort of like she did today in the session, taking the time and the ability to express her feelings more directly to you so you can know specifically what she's upset about. Because I wonder when she's rolling her eyes and doing that, Mr. Smith, that you aren't actually sure what she's upset about. You're making an assumption and you're making a hypothesis, but you don't actually know for sure what's really bothering her. And so how can the two of you find a way to check in with each other like you were able to do when we practiced for this session, where you could say how you're feeling and you can ask Dad if there's a way that he can respond to you that will help you to feel better? Because what we did today surrounding going to the soccer game and letting Dad know that the drama queen comments upset you is an example of the communication process that I want the two of you to be able to practice even around other topics. So is there a way that you can think about, so Dad just said that he thinks that you don't understand. Well, I heard Dad say that he feels you don't understand that he's got a lot to do when he first comes home from work. Is that what you're feeling, or are you feeling something else that you would like to share with him?
No.
I know I'm putting you on the spot and we didn't rehearse it, but I think that you've done such a good job communicating that we can work on that.
Well, I guess I don't expect you to just drop everything, but a little bit of like checking in to see how I'm doing and talking about our day, that I don't think is unreasonable.
So what would that look like to you, so maybe Dad can understand a little bit better?
Well, I think it would be nice if you asked me how my day was. Like, I know before I would snap at you and stuff, but I'm going to try not to do that anymore. So it would be nice if you started asking me again.
Mr. Smith, what do you think of? Does that seem like a realistic expectation for her to have?
Yeah, I can definitely make that happen. I know that I kind of stopped doing that ever since you gave me the cold shoulder. It didn't seem like you wanted to talk, so I kind of stopped doing that. But if that's something that you want, then I can start trying again.
Do you want to practice that in here, Mr. Smith? I know that you haven't had an opportunity to practice, but maybe the two of you can just try that here so you have sort of a model for what you can keep practicing at home. So how could you ask her how her week was?
So Tara, how's your day been? How was school?
It was good.
Did anything exciting happen?
Nothing exciting, but I had a pretty good day, which is, kind of nice because school has been not as fun ever since Eric left, ever since Eric graduated, so.
What was so special? What made it a good day?
Well, I started talking to Abby again,
That's great.
and I think we're gonna try to get our lunch period together.
That's great. It's good to hear.
So how does it feel for you when Dad checks in?
It feels really good, and I liked it when he asked me like more details, like what was so good about your day.
And Mr. Smith, how does it feel for you checking in?
It feels good. I like knowing what's going on and having Tara explain when she's having a good day and what I can do to make it better.
So I think what we've tried to illustrate in practice today is that if the two of you can find some time alone, it doesn't have to be a half hour, even 10 minutes where the two of you can sort of check in with each other, and so that you can have a better sense of what's going on with Tara, and Tara can feel like you're more tuned into her. I wonder, is that would help you to feel better? And
Yeah.
sort of what you were trying to teach Dad today, right?
Yeah, I don't mind if other people are around if you ask me.
So we practiced a little bit today, and obviously we don't always change overnight, and our old behavior disappears and our new behavior takes over. But this, what I would like the two of you to try and keep practicing over this next week, this way of talking to each other, using your I feel statements, making sure that the two of you find a good time to be able to talk when you're not so distracted with the rest of your family, Mr. Smith, and when Tara feels that she can get some of your attention so that she can let you know how she's doing. And then maybe you will feel less inclined to make some of the comments that were sort of upsetting to her, because you'll be more in tune with how she's feeling through the check-ins. And then I will get to check in with Tara next week and see how your practicing goes and see how we can keep helping the two of you to improve your communication, because it's clear that the two of you really love each other a lot. And the goal is to really get you to be able to enjoy your relationship again, so that the two of you can spend more time together and feel better about each other. So thank you so much, Mr. Smith, for coming in today and being so willing to work on things with your daughter. I appreciate that. Tara, would you like to say something to Dad too?
Thanks, Dad.
Great. All right. Tara, I'll see you next week.
Okay.